Good morning and welcome to the second day of the fourth Diagnostic Leadership Summit. We are now heading into the panel discussion on pandemic inducing lab accreditation for enhanced diagnostics. We are delighted to welcome Dr. Vinita Sood, Lab Director, Department of Lab Medicine, Alchemist Hospital. Welcome, ma'am. Dr. Abhik Banerjee, Zonal Technical Chief, East Zone, Apollo Diagnostics, who will be the session moderator. Welcome, sir.
Thank you.
Dr. Puneet Kumar Nigam, Chief Quality Officer, Metropolis Healthcare Limited. Welcome, sir.
Good morning.
Dr. Dinkar Desai, President, TPA and APPI. Welcome, sir.
Thank you.
And Dr. Seema Kochar, Principal Director, Quality Management and Excellence, Dr. Lal Path Labs Limited. Welcome, ma'am. I now hand over the session to Dr. Abhik Banerjee to take the discussion forward. Over to you, sir.
Thank you. Uh, Good morning, everyone, and good morning to the organizers for creating this session. We are really delighted to be part of the discussion again after the COVID-19 pandemic. I also my sincere regards to the esteemed panel members, who are the doyens in their respective fields, Dr. Puneet, Dr. Vinita, Dr. Seema, Dr. Dinkar Desai. And I am also really thankful to all the delegates who are already listening to this or were the audience or spectators of this live session. We think we will have a very fruitful discussion here. Today's panel discussion topic is a pandemic, COVID-19 pandemic, basically inducing lab accreditation, how it is helping laboratories to adapt accreditation to be more quality concerned, and directly or indirectly, that is definitely influencing the patient's outcome, because we know that today more than 80% of clinical decisions, therapeutic management decisions, are being taken on laboratory reports. So unless the laboratory reports are very much accurate, authentic, and error-free, we cannot go forward and we cannot ensure the therapeutic outcome of the patients, good therapeutic outcome of the patients. So with this note, the keynote or opening thing, I would go to the panel members. We will have some questions, discussions, and definitely after these questions are over, we will definitely ask for suggestions and feedbacks, and also some questions, if time permits, from the delegates for their valuable opinions and they have any queries regarding the subject or topic. So my first question is to Dr. Puneet Kumar Nigam. Uh, Sir, how has the pandemic, this COVID-19 pandemic is going on since last 2 years, and actually we are not sure whether the fourth wave will come to India or not, because already the countries like Korea, China, they are having, and we have heard that some mixed strains of Delta and Omicrons are already in some states of India have been detected. So, with this findings or with this apprehension in mind, how has pandemic influenced the adoption of accreditation across labs, and whether there is any adoption difference among big and small labs?
So, Dr. Abhik, that's a big lesson we have learned in this pandemic, because the pandemic came as a surprise, and the whole healthcare industry in India and abroad was just taken to task to check where they are and what are the capabilities. And knowing the Indian infrastructure, the healthcare system is was fragmented between public, private, organized, not organized, and it was a very big stretch for the government to manage a pandemic of this sort in the country. But what actually happened, and the outcome of this is some interesting decisions government took in the early stage, which was making accreditation mandatory for any lab to report COVID-19. Now, when we were not having pandemic, multiple times we discussed whether accreditation should remain voluntary. If it becomes compulsory, will it help the lab overall quality of, diagnostics? But we could not decide in one way or the other. but pandemic helped the government to take this decision simply because accreditation gives that kind of confidence,
Hmm.
because it is unbiased, third party, and whether you are a big lab, you are a small lab, you meet those minimum requirements, and you can be confident that what report you are releasing is right. So that way, the COVID pandemic has been a landmark experience for the nation, and to a large extent, I would say, because the path was chosen correctly, and the decision was taken that accreditation should be there for any lab to report COVID-19. I think we did pretty well overall.
Yes, 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 yes.
And we had this scenario where 1,400 odd labs in a big country like us were accredited, which is very small number. And today I think we have more than 2,200 labs which are accredited only thanks to COVID.
Yeah, yeah, yeah.
So 15 years of journey we did in 2 years, repeated it, and we did it in a better manner.
Yes,
And
yes,
these small labs are not only in metro cities, which was the pattern before,
hmm,
but they are also in the interiors.
yes,
So that was the need of the hour. And because this pandemic persisted from wave one to wave two, wave three, and maybe a question mark on wave four. So labs and the businesses, people in the healthcare industry got a chance to align themselves. And I think that is where accreditation
yes,
has really helped. And when we say accreditation or a lab, what does it really require? It requires infrastructure, it requires
hmm,
processes to be manned by people, who are skilled and qualified and experienced.
hmm,
And these are some of the pain areas of industry also. So
yes,
in peace times we are struggling, but in the pandemic we all managed, and lot of
yes,
skill was developed, lot of trainings were done, lot of infra was
yes,
created, and I think that is where the whole approach of accreditation being mandatory, we
hmm,
could achieve it, because if
yes,
you are accredited, you can't escape from any of the items which are kind of mandatory.
yes, yes,
Otherwise, the labs who are doing it without accreditation, there are definitely labs who are not accredited but delivering very good quality. But accreditation is a framework. Once you have it, you have to comply. So
you
it
have to
gives you
comply.
that additional motivation and compulsion.
Yes. This
So
is a very actually pertinent point what you raised, Dr. Puneet. So once I think like you are once you have get accreditation, that quality concern, that quality consciousness is built among the staffs. You are always on your toes to maintain the accreditation, because getting accreditation one thing, but maintaining the accreditation and going to the next level is a different issue altogether. So that
right,
is because we know, even we during the audits we have faced that once that when the first audit takes place for a lab, it may be at a particular level. They are looking after how much training you have done, how much do there's these things what you have done, whether your machines are calibrated or not. But when you face the next audit, the questions are at a different level, the inquiry at a different level. They are asking for the competency evaluation. They are asking that they last time they asked for the training need, but now they want to see whether the training feedback is there, whether the evaluation, post training evaluation has been conducted, whether the training need of the staffs has been satisfied. Those things are so in the next level. So you, as you rightly pointed out, that to comply with the rules and regulations of ISO 15189 2012, that is the importance, and pandemic has taught us, and most of the labs has adopted. So my next question is to Dr. Vinita Sood, that accreditation is a risk reduction activity. What I mean, in the COVID, during the COVID-19 pandemic, what has happened, that we have all the laboratory staffs were under like a Russia-Ukraine war. We all were under immediate threat. Suddenly, we didn't expect that this might happen. It's a so risky procedure, extraction room, we had to take PP and those many other things. So, by any way, it is apart from the process related things, we are maintaining the fumigation of the room, etc. But how accreditation help to this risk reduction activity of this COVID-19 pandemic? What is your thought?
Good morning, everyone, and thank you, Dr. Abhi. Very well valid point, the risk reduction. And according to this pandemic, as Dr. Puneet has said, that it has taught us so many things. And in accreditation, they have two main things. That is, one is training, and other one is the safety, the place safety, the workplace is safe or not. And accreditation recommends that labs should have active role in minimizing the potential errors by developing QSP, that is quality control plans. Labs should identify weak points of each testing stage. That after identifying the risk and select control process to prevent or minimize its occurrence. And in pandemic, the safety of the staff were the foremost. And every day there was a guidelines from local authorities, from national, international agencies, how to be maintain the distance, how to wear the PPP, then where to put this and where to keep this. And accreditation teaches us all to identify this, to analyze this, to control this, and to monitor this. And once implemented, to check the efficiency, that was very important. Continuously monitor it, and if needed, you have to revise that your protocol. And
Yes.
there were continuous audits, and it was the remote audits, and digitalization and everything. And first, when accreditation teaches us the risk reduction activity, because it gives us at 3 points: pre-analytical, analytical, and post-analytical. First, they teaches you how to prepare the patient, how to collect the sample, how to label it, how to mix it, how to store it, and how to transport it. And in pandemic, this was the main thing, because there was a nasal oropharyngeal samples, how to prepare the patient, how to prepare yourself to take the sample, how to wear the PPE, how you should be safe for yourself, and then the patient safety, then safety of that sample, that sample should be safely transported to the lab. Then
True,
analytical,
true.
then analytical also, then how to run the QCs, then testings, then review, and how to interpret it, and how to interpret it like ICMR guidelines, the CT values and everything they were given. Every day there were a new guidelines from the
Yes.
ICMR, and release of results, whom to tell, whom not to tell, critical, how to paste the QR code, what to give in QR code, and everything. And this all has been given us about the accreditation guidelines and the ICMR guidelines, which gave us the confidence, and they encourage us, they guide us, they assist us to do this. And once implemented, they teach us how to check the efficiency. They taught us how to monitor it, how to revise it. And that was the third eye check from the accreditation bodies. And again, the ISO 15189-2012 has again one clause on risk management, which we were doing already, but pandemic has uh, taught us more about it. They have really led to the path of the safety. I think the safety was the main concern, which accreditation labs, accredited labs, have really did it well with the help of the local, national, international agencies, because they undergo continuous audits. They know what is the value of safety and training, and they have really, really worked hard and did well.
Okay. Yes, rightly pointed out. So many things actually we understood. Now, next question to Dr. Desai, Dr. Dinkar Desai. Uh, See, it is true that, as Dr. Puneet also highlighted, that NABL ICMR was in a hurry to start the labs because the COVID-19 cases were surging like anything. But at the same time, ICR made it mandatory that before starting the COVID-19 testing, to maintain the quality diagnostics, laboratory must have NABL accreditation. So, it for many labs who were already NABL accredited, but the problem was that they didn't have molecular biology setups. So they had to undergo first set up a molecular biology lab, then its accreditation. Some labs were having that they were having tests like HBB, DNA PCR, HCV, RNA PCR, So they were NABL accredited, but the COVID-19 is altogether a new test. So there are many challenges for the labs also to cope up with the requirement to start COVID-19 when the local government, state government was repeatedly hankering after them to start the COVID-19. But there are many challenges. So, sir, my next question is to you: that how did the labs gear up to meet the standards requirement and to cater to clinicians' requirement at the same time?
When COVID-19 started in India, at that time you must be knowing that Kasturba was the only facility which was available even for the metropolis of Mumbai. So ICMR decided to gear up this whole situation, and as rightly said by you, it gave permission to the laboratories who are enabled accredited to open this molecular laboratory for PCR testing of RT-PCR of COVID-19. So slowly, a few laboratories, which major laboratories initially joined, but it was a big problem for small laboratories. There were laboratories of microbiologists who were geared up with this PCR equipment and all the systems. So they definitely contributed. I know in Mumbai there were something like 8 to 10 microbiologists who immediately joined. So the load was shared initially by all these laboratories. And as the first wave receded, we thought now it is not much required. But there were some wise people who thought that it is prudent to invest. And as the first wave was receding, there were many who invested, who developed, who geared up, who got accreditation of NABL, who got approval of ICMR, who got approval of government machineries, and they started the uh, COVID laboratories for RT-PCR. And the result was evident when the second wave was there. There were so many laboratories, and the load was shared by all these laboratories. Then simultaneously, government introduced about rapid testing, and this was also taken care of by uh, laboratories, many laboratories. And last but not least is genome sequencing, which was also in a later stage, third stage. It was also taken, and the pathology department of India responded well.
Yeah.
Uh, for cross-checking, National Institute of Virology, that was very much there. And now, as regards every swab which is tested for COVID, there is cross-checking. You have to send the swab to ICMR, and it may so happen that if you are going wrong, you will not be allowed to continue the lab. So this kind of threat itself is important to maintain the quality and standards of RT-PCR reporting.
Yes, sir. It's perfect, actually. It's very, very important, actually. So you have already mentioned all the points. Actually, this is a very good point, actually, that ICMR has also made it a mandate that, see, most of many labs, almost all the labs, they started this COVID-19 test for the first time. Some of the labs were doing H1N1 testing, swine flu testing. I can remember my last organizations we were accredited for H1N1. But COVID-19 is altogether a different ballgame. So it was a good initiative from the government organizations, National Accreditation Body for Testing and Calibration Laboratory (ICMR), that, as Dr. Desai rightly pointed out, that they made it a mandate that you have to participate in a ECAS or proficiency testing program. At that time, there was no such commercial ECAS program. Like usually we participate in CMC Velour or whatever, Randox or Biorad or AIMS ECAS, etc. At that time, it was not there. But they made it a mandate that you have to go for a interlab comparison. With whom? National Institute of Virology Pune, NIV Pune. I can remember, even I have entered the data that NIV used to send you the data. We have to enter in the portal, five sample positive, five sample negative. They had made a city values cutoff, like in this city value, borderline things would also be captured, whether to ensure, just to ensure that laboratory is not giving any false positive result. So, because we all know that RNA is very fragile, so CT value may deteriorate, etc. So, what is the your storage protocol? What is your how you are handling the patient samples? Everything needs was covered by this interlaboratory comparison program. Later on, I can remember that we participate in a Biorad standard. There was a Biorad standard ECAS for COVID-19. So what it gave a normal standard, it gave a high standard with high city value, and we used to run it on a weekly basis. It was very costly, so we could not do it on daily basis. But with the change in manpower of the technical staff in extraction room, when there is a change in reagent lot, we used to run this high standard and normal standard just to check whether everything is in uh, process. So with these things, I will ask another question. I will request the opinion of Dr. Puneet, that how has the accreditation help labs maintain a balance between quality outcomes and faster turnaround time? Because uh, especially we have seen, sir, the CMOH offices, that government offices, local office, they were actually they were sometimes they forced us to. I mean, they were requesting, it is just for the patient's sake, but you have to report within 24 hours, maximum 48 hours. But at the same time, you have to maintain your quality protocols. As Dr. Vinita said, quality management system policy. You have documented your standard operative procedures separately. So, how the balance was maintained by, because you are from a reputed diagnostic chain, so you can explain us how you had to cater to that volume as well as you have to maintain that quality.
So one very unique thing with this COVID was that it was an activity done at a national level and in fact international level. So data was required by the governments, local governments and central government almost in a real time manner. So labs still now had the mechanisms to collect the sample, process the sample, report the sample. But another dimension got added in which now there was an app. Actually, it didn't start with the app. It started with the form. Then later on, government launched the app. So from the time of collection, the data was going to the government through the app, and then the report also had to be released or punched into the app. So these two activities were over and above whatever the accredited labs were doing till now. So they had mastered all the processes and systems, but when these two steps came, they posed additional burden. So when government said 24-hour TAT, 24-hour TAT was not very difficult for molecular testing using automation or manual. So if the labs had high volume, they would go for automation, and 24-hour TAT can be easily met. But to meet the TAT and report this data within 24 hours, this was the challenge, because this was new to the labs and it required a different set of people. You had to create a team, you had to you had to train them on punching the data. Since it was manual activity, there were a lot of errors, like phone number is not right. So if the report is positive, the local health authority is calling and the patient is not there, it's a wrong number. So all these things happened in the initial phase, which really put lot of pressure into the system, in the government and in the labs. So I think the good thing which happened was that government was always talking to the labs, and they both of them were engaged. So there
Yes.
was an exchange in what is the problem, how to find the solution, and somewhere in the middle of the wave two, labs also realized and developed their own mechanisms to report the data. So I'll just give you an example. If we had 500 samples to report, maybe in the initial phase, we would have required maybe 4 people to punch the data and 5 6 hours to release it. But later on, with the automation, with some of the uh, software tools which labs developed in house, we could almost do it in 15 minutes later on.
Yeah.
So even while reporting 10,000 samples, it could be managed. So I think the challenge was not in terms of the conventional lab processes, the fact that it was molecular testing for maybe the bigger labs who were doing it, it was relatively easy. Labs which were starting for the first time, they had to master the testing, the sample collection, because COVID collection had so many aspects to be strictly adhered to, and then managing the data. So I think all across data management was the biggest issue, more than
Yeah.
anything in terms of testing. But eventually, government also changed. We had, earlier the day we asked government that can we push the data into the system directly, and government was also at a loss to see if the state government had requirements asking in different formats, central government different formats, but the lab team was limited. So because of all these things, I think it put a burden, and that became an issue.
Yeah.
But now in the fag end of the COVID, so labs are releasing report in 2 hours also. So now
Hmm.
the test design has changed. You have kits which don't require extraction. You have rapid kits. You have new systems. So technology changed in terms of the instrumentation, in terms of the kit, in terms of
Yeah.
the runtime, and major change came in how we manage the data, which is the process automation.
Yes.
I think all this really helped the labs, and since all the labs were accredited, to give a faster TAT, continuously to give a faster TAT, and there was, in fact, reduction of errors, no compromise of quality, and a faster TAT. So
Yes.
this was
Yes.
the ideal outcome actually one can think of.
Right. Right. Thank you, Dr. Puneet. Yes, really, you gave a broader aspect, actually, broader view. My next question is to Dr. Seema Kuchar, madam. Dr. Seema, actually, we were, as we have understood how the accreditation, quality, and technology, with all these, laboratory maintained everything. Laboratory had to gear up the laboratory, and ultimately, we could serve the patients in a very better way. Many labs have tested in a day 5,000, 6,000, 7,000 samples, and we all know that even doctor, you are coming up for a organization where they have, in my cities also, they have processed almost 6,000, 7,000 samples per day. So what are the did you I would like to understand that, being a from a private sector, how your lab technology upgraded, your lab has upgraded the technology to meet with the faster turnaround time, but without compromising with the quality. Did you use any point of care testing, or it is only a RT-PCR based test? Is a closed system or open system? So how the overall technology you maintain, that I would like to understand.
Yeah, so Dr. Rabi, thank you for your question. We are, as you said, we are a private lab, and we cater to a huge volumes. And this pandemic, I mean, my fellow colleagues here, the Revit panelists, they would agree that pandemic brought the laboratorians, as I would like to call it, just like clinicians we call it. So they brought laboratorians to the center stage of all. So just like many labs, when big players they adopted technology, we too adopted technology. We had to adopt. We didn't have a choice but to adopt, because we were catering to a huge volume surge, especially during the second wave. But during the first wave, we did, you can say, kind of prepared for such huge surges. We did adopt digital tools to, like what Dr. Puneet has said, that to enter the data into government portals and create APIs, so that faster. Not only patients are given faster reports, but we are also giving faster data back to the government, so that necessary actions could be taken at their end as well. So laboratories have been under a huge, tremendous pressure. So there have been change in kits, there have been change in various protocols. We did devise the emergency use protocols just to manage, because during this time, the with evolving guidelines, this has been a fluid process. So we did evolve the validation protocols also, not to say that there was any bypassing of the quality, but they were very strict protocols. And we did all that through with the great help of our the top management directive was to go right at it, but maintain quality at every step of the way. So we also did, being a accredited lab, we did not only limit ourselves to, the just for the, I mean, the patient safety, which is actually at the core of everything that we do. We also took care of the staff safety. So for us, I mean, accreditation is a risk reducing activity. It is now, as what many laboratorians would agree, my fellow panelists would agree, that it is now coming out to be an holistic process. And technology is something, because diagnostic is moving slowly towards, in fact it has leapfrogged, I would say, toward digital health. And diagnostics is the backbone of all this. And digital means use of technology is here to stay. And this will give the required momentum to various laboratories. And the sooner we adopt, we have adopted, the more we adopt, we will definitely be benefiting going way forward.
Very true, very true. Actually, even I remember during the pandemic situations in my organization's Apollo Diagnostic, we already had a molecular biology setup. We were doing HBV DNA PCR, HCV RNA PCR, HLA-B27, etc. But when this COVID-19 pandemic came up, we had to train vigorous training for our technical staffs, including the consultants for reporting and everything. We developed our own quality management system policies and dedicated standard operative procedure for COVID-19, not only in analytical area, but how the samples will be collected, training the sample collector, not phlebotomist, I will say, the sample collector, swab collectors, training the SRA people, sample receiving area accession people, how to handle the samples to minimize spillage, etc. We adopted lots of technology and training. BSL level 2 minimum, level 2 A or level 3, whatever the BSL cabinets, putting up ultraviolet lamps, negative pressure rooms, and those things. So all labs, not only Apollo, Lal, Metropolis, whatever we are working, Alchemist, but all labs had to gear up. And these kind of technologies, innovations, we could see at least in a very short time. So we never imagined before the pandemic that with this faster rate, the laboratory can upgrade themselves. And that was the magic of this, that was the beauty of this situation. There are many negative sides of this pandemic, but at the same time, I will say this was a boon for the diagnostics, probably the in vitro diagnostic facilities, for us commercial private labs or even the government organizations, to showcase that how fast the laboratory could adapt to these situations, and they could help the government to manage the situation in such emergency. That is really very helpful. Anyway, I
And
would go
one
to
more thing, Dr. Ravi,
yes,
I would like to add one more
yes,
point here that you said pandemic, kind of forced us. We geared ourselves up for facing the difficult challenges which lied ahead. No one could have thought that at one point of time we would be catering to thousands of samples and giving faster reports. So
yes,
pandemic gave us that challenge, and it is during these challenging times, this these challenging times only give us an opportunity to redefine our future. And what and this
yeah,
is the right time, it's a right moment, right time for us to make use of these this time, and make use of technology, in our way forward for this adoption of digital technology, digital health, and everything that is which we foresee and we envisage the future labs to be.
yes, yes. Thank you, madam. And my next question to Dr. Dinkar Desai, because this question is especially to him because he is being the mentor of many labs. He has a vast experience in both government and private sectors. Uh, and that's why my question is, how do you think, sir, the accredited labs' agility and faster adaptability to challenging situations helped them during the pandemic?
Yeah. The I didn't get your question, sir. Can you repeat, please?
Yeah, but actually, I would like to just know because you have a vast experience. So to see many labs, both small size laboratory, middle size, and up the corporate labs, how do you think accredited labs' agility and faster adaptability to challenging situations help them during this pandemic?
Surely. Uh, you can see that simultaneously there was uh, RT-PCR testing, but the other small laboratories, private laboratories who had got accreditation, they thought of doing antigen testing, rapid antigen testing. So that contributed a lot of things. In addition to that, there was a quite huge demand for COVID antibody testing. And as vaccination progressed, there was a need that whether the vaccination is successful or not. So, so this kind of antibody testing was also important. And you will see that a COVID profile was created, just like your lipid profile and hypertension profile and diabetes profile. A COVID profile was a very new thing for the newly accredited laboratories in India uh, to meet the TAT, because this was the most important thing in COVID management in hospitals. So these hospitals required the follow-up. मतलब diagnosis तो हो गया, but the prognosis, that was very important. And for prognostic tests, there were a battery of tests which were designed, say like ferritin, interleukin 6, LDH, D-dimer. So these were the tests which were required to be done by these kind of pathology laboratories. And yes, C-reactive protein assumed a very great significance in COVID times. Even high sensitivity C-reactive protein was also required. So these were the changes which took place in COVID times.
Thank you, sir. Thank you. Yes, Doctor Vinita, you are also being from a private, good, commercial, and huge laboratory who participated a lot. We have heard during the COVID-19 pandemic and get gave momentum to this journey of COVID-19 testing process. So, what was your challenges? How you have come up with the solution that you have to give a faster report at the same time you will have to maintain the quality. So the same question of Dr. Dinkar Desai I would like to ask: how was your focus, how your lab performed?
Uh, yes, as we have already discussed, the accredited labs are agile, able to adapt quickly, they adapt faster to challenging situations, and they have adapted during the pandemic because accreditation taught us to be proactive. The accredited labs are proactive. They accreditation help us to teach transfer quality intent on all levels because quality is consensus, that is doing right at right time. And for pandemic, there was everything was wrong, we have to make it right. And trainings were given at every level regarding the local agencies, and then about the national international guidelines and guidelines issued by our accredited NABI, uh, accreditation agency. So the staff in accredited labs is always skilled, competent, and there was so much of guidelines. At once there was going training about the guidelines, and then training about the new test. As Dr. Desai has said, the D-dimer, interleukin 6. Then in molecular testing also, it was not that simple. There was a dress code, there was a PPE, there were different rooms. You have to change it like this, you have to take the sample like that. The staff was already in that mindset to improve, to take training, because quality is a continuous process. They know that quality is a continuous process. It is without a finishing line. It will continue. It is evolvement. So you have to evolve every day. So training, this gave them power to adapt. And adaptation is the core strength of accredited lab.
Fantastic, Anish.
So they know whenever there is an audit, there are areas of improvement, there are non-conformities, they have to close them, there's a limited time. So staff was always in a framework of competitiveness. They have a confidence, they have a power to adapt, power to improve, and above all, the intent was there. Intent was there that we have to help the society, we have to help this, we have to come over on this pandemic, and we have to do this. So I
Yes.
think because accreditation is a voluntary process, we all know, and this voluntary process gives us intent for the quality. This intent is in every and each level of the lab. And as there is no compulsion about the accreditation, so open mindedness is there, proactiveness is there. So they really, the lab staff has that ability to adopt and to be agile and to take everything positively. So they have taken everything positively. They took the trainings regarding the digitalization, remote assessments, QR codes, how to put everything at place, how technicality as well as non-technical, as well as digitalization, non-digitalization, everything they have really done well, because I think the accredited labs have that uh, core strength in them to adapt, and that adaptation has really given them proactiveness in this
Yeah.
situation.
So it is really, I think, almost all every matter in this panel discussion have been discussed. How the accreditation process ICMR started, NABL helped us in getting accreditation without compromising quality, but at the same time at the very faster rate, so that most of the labs got accreditation. Dr. Seema, Dr. Desai, Dr. Puneet, Dr. Vinita have already discussed about the technologies upgradation in their respective labs, how the labs geared up to cope up with this challenging situation in a very shorter turnaround time. My point is whether that another thing I would like to highlight. See, now the COVID-19 pandemic is almost, we can say, if the we hope that fourth wave will not come to India, and the other countries which have already going through the fourth wave, they will slowly come up with this situation, and it will not last longer. So if the pandemic even goes from this earth, we have to be careful as laboratoricians, as Dr. Seema said, that whatever pandemic has taught us, faster turnaround time, not compromising with quality, gearing up with a very short turnaround time, and ultimately serving the patients and our clinicians in a better way. We should not forget all this. This should be a lesson for all of us, that we cannot compromise with quality even the pandemic goes away from this earth. We should maintain all these protocols, participating in proficiency testing program, participating in daily internal quality control, training of the staffs, and overall safety, maintaining safety of staffs and all our technical team, which are the backbones of our laboratory, in a better way. And that will be the real benefit from this pandemic. And then we'll be, as laboratoricians, we'll be able to comment that yes, the laboratories are successful in managing the situation. With this note, I will request Dr. Puneet, Dr. Desai, Dr. Sima, or Dr. Vinita if they want to mention anything, because we have to take some questions from the delegates if they have. So, Dr. Sima, if you have any concluding comments for for a few seconds. I mean, we have already covered 1 hour. I think that's why you
Yeah.
have any comment.
Yeah, so just my closing comments would be that accreditation is now a holistic process, and it's actually a biggest enabler. I mean, as we have seen during the pandemic last 2 years, to deliver the quality outcomes, keeping patient safety at its core. And adoption of technology will provide momentum for a future ready diagnostics, as digital health is going to become a way of life.
Right. Thank you, Dr. Desai. If you have some, we can.
Yes. Just now, Dr. Puneet mentioned about the number of accredited laboratories in India, and the percentage is very dismal. It is just maybe 1 or 2% of the total laboratories in India. They are accredited. So, what is the solution for this? One is simply one can say that let all the laboratories get accredited, which is not possible because the laboratories which are mushrooming, they are not interested in getting accreditation. So the alternative to this will be restriction on the part of government, and there should be a compulsory registration, and there should be a law of for running a pathology laboratory. And the good news for this forum is uh, the efforts we were taking has received some kind of success, that the health minister of Maharashtra in the floor on the floor of assembly has said ki, we will be coming out with a laboratory pathology laboratory act. This will give registration to each and every laboratory. It may be run by DMLT, but it has to be guided by and authenticated by MD pathologists. So
Very important point.
once this comes, then the accreditation process will take a major seat.
Major seat. Very important. You have rightly pointed out these things. Actually, this because in India anybody can open a lab and they can run the lab. So there, the entire purpose
My,
of quality and accreditation
my,
is
my,
getting.
my only worry is only pathologist associations are talking about making
Yeah.
registration compulsory and making illegal laboratories to be banned. But I find that Metropolis is here, Lal Pathology Lab is here, Apollo Diagnostic is here. These are the big institutions, and they also should raise the same voice, because if that is done, then your business is also going to be multiplied.
Yes. Yes.
Why you don't put your hands together with us? Thank you.
Yes. True. Dr. Puneet, with your vast experience, if you just conclude the session, and Dr. Vinitra, if you can conclude the session with your concluding remarks, then I can request Elets team to take over.
So what Dr. Dinkar has said, I think big labs have been silently supporting this always, because within the group we are continuously increasing the number of labs which are going for accreditation, because we have understood the benefit out of it, and it has come into the fiber of the organizations. And that is a decision which is, I think, pending with government. If any representation will help, I think we'll be very much for it. What COVID has told us again is health of an individual is of prime importance. Uh, and this is mental, physical health, a holistic health approach. And that holistic health approach for a lab or a healthcare industry, accreditation plays a very important point. And another big learning out of this is that we are delivering quality service, but we are also able to manage the cost side of it, because during the COVID, the government and the industry work very close together. And only quality does not suffice, because cost efficient delivery is another very important task. And I think COVID has helped all of us to achieve that goal. So I think our healthcare industry is going into a different kind of orbit, not only quality delivery, but cost efficient delivery, thanks to availability of made in India products, which really helps.
Yes. Yes. Yes.
Yeah.
Yes. Thank you,
Thank you.
Dr. Vinita. If you can just finish the session, Dr. Vinita, if you have some additional
Uh,
comments.
I Yes, I fully agree with Dr. Dinkar Desai, sir. Uh, we must go. ahead with something, or government should do something about the labs. It should be manned by a educated or persons. It doesn't mean ki, DMLTs, but DMLTs are the technical support, and pathologists are like to prove, and there should be, and it should be encouraged and assist the lab to go beyond what is regulated and strive for high level of quality and safety, and it can always be by the uh, experienced persons, and I think there should be some law regarding
Yeah.
this regulation of the
Yes.
lab.
Yes.
I
Yes.
And in this pandemic we have seen the importance of labs, importance of scientific officer, importance of pathologist, importance of microbiologist, biochemist, and what is required. So I think pandemic has really shown to the world that laboratorians, as the Seema Kocher has given us the word, the clinicians and laboratorians. So we also got noticed, and
Yeah.
there should be some law regarding the regulation of the laboratories, and there should be, and then only we can get the best quality and safety in this field.
Yeah.
That. Thank you.
So thank you, and like last thing is maybe an appeal from all of us, the laboratorians and healthcare workers, and in working in the diagnostic sectors, that government should push up more in this Make in India initiative, as Dr. Puneet said, because once we are not dependent on the outside countries for the reagents, for the VTMs, for the instruments, etc. Whatever the closed systems or open system, then the cost of the infrastructure for a molecular biology setup or overall a laboratory setup will drastically come down, and this will probably help the small labs also who are interested to good works, but they are not getting the appropriate platform to prove themselves as a good lab due to lack of accreditation because of this huge infrastructure related expense. If we start this Make in India initiative, and if we give more stress on that, obviously with the cost per test will be reduced, because the instrument, manpower, everything will be, and then we'll be more able to adapt accreditation, the more quality norms, and implement quality system in the inside the organization. That will help us. So that is an appeal towards from the all of us panelists to the government probably. And with this note, I thank the organizers once again, the delegates and the panel members who participated in this discussion. And over to Ms. Kanchi Chawla, the Elets team, for this wonderful session, and to conclude. Thank you.
Thank you. Thank you so much, Dr. Abhik Banerjee, for your wonderful moderation throughout the session. And I thank all the panelists for their insightful views on the session. Thank you so much, everyone. We would like to inform our esteemed gathering about our upcoming events, which are the fourth Pharma Leadership Summit on the 26th and 27th of April, the third Radiology and Imaging Summit on the 26th and 27th of May, and the Medical Education Summit on the 23rd and 24th of June. We look forward for your constant support in future. I once again extend my warm gratitude to all our esteemed panelists for their time and presence, and please accept a small token of gratitude from our end through these certificates that we present to Dr. Seema Kocher for her insightful views on the session. Thank you so much, ma'am. Dr. Abhik Banerjee for his wonderful moderation. Thank you so much, sir. Dr. Dinkar Desai for his keen points. Thank you so much, sir. Dr. Vinita Sood, thank you, ma'am, for your views. And Dr. Puneet Kumar Nigam, thank you so much, sir, for sharing your points. Thank you, everyone. It was great listening to all of you. Thank you so much.
Thank you.
Thank you.
Thank you.
Thank you.